Good medicines for that?
Good medicines, there's two different classes. There's medicines that stop it, we call them aborphicant medications, and there's medicines that help prevent them, we call them prophylactic medications. The good medications, if you can tolerate it based on your health and some of your other migraine characteristics, are called the triptan medications. So like Imitrex, Maxalt, Relpax, all good medicines. They all have triptan in their generic name.
They're much different than when I came into medicine in the 70s and 80s. We used to have to really treat early. Tell me about the triptans and treatment. When can you treat them? How do you treat them? What do you do? How effective are they?
They're really very effective. They're most effective though when you treat them early. That hasn't changed from migraine management. There was ergotamines before the triptans did similar things but caused a lot of other unintended consequences. But the triptans, if you take them early, at the onset of your headache, you feel like it's coming on, if you happen to have a warning or an aura with your migraine.
What is an aura?
An aura would be a warning, a premonition, something's going to happen. You might have some numbness over your face, maybe some shimmering spots in front of your eyes, maybe some tingling in one side of your body, or sometimes people feel sick. They start yawning, they know something's coming on, they feel a little bit of ache and pain. Those can be some of the auras or premonitions.
Common to have an aura or common to have the headache without aura?
People that have migraines usually have both, but more than not, people do have some kind of aura.
Prevention you mentioned earlier. Here we're treating if you get it. If somebody's having those frequent, they're devastating. How can you help prevent a migraine?
There's some medicines that they use that kind of help stabilize or calm the brain down. Some of them can be as simple as magnesium. Sometimes the mineral magnesium can decrease the neuron irritation that sometimes leads to migraine headaches. It can go to anti-convulsive medications like Topamax or Depakote will help also kind of calm the neurons down, decrease the frequency of headaches.
So we calm down the brain.
Calm down the brain.
So it doesn't trigger off migraines. How about some others like beta blockers? What do they do?
Beta blockers also, they think, decrease some of the vessel spasm. So beta blockers or calcium channel blockers, medicines like propranolol or verapamil will also help calm down, decrease the frequency of the migraine headaches.